Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about how you can isolate the different calf muscles or muscles in the back portion of the leg in order to stretch out a particular muscle. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I put up here on my channel. So essentially in the calf area, there's two main muscles that I'm going to be discussing today. One is called the Gastroc muscle. So this is the more superficial muscle of the two, and it attaches onto the Achilles tendon, and it's one of the main muscles that we'll find gets injured with pushing off type activity. So when the knee is completely straight and we're going, let's say, up on our toes in a very forceful manner, that can cause potentially, right, a strain of that particular muscle. And then the muscle that's slightly deeper to that is called your soleus muscle. And so in a lot of cases, individuals will be trying to maybe stretch out that calf area, but they might not necessarily be isolating the correct muscle when they're stretching. And so they might find, hey, you know what, I'm really not making much progress in terms of general mobility in through this area. And it might just be a result of not isolating the muscle correctly. So I'm going to show you a way to do that. So essentially, when we're looking at stretching out the gastroc muscle, let's say, we want to make sure that the knee is actually straight. And the reason for that is the gastroc muscle, which again is the muscle just on the side here, it actually crosses the knee joint and crosses the ankle joint. So in this case, we actually want to make sure, right, that the knee is fully straight when we're trying to stretch it. And so the stretch would look like this: knees fully straight, and then I'm bringing my toes up towards myself, right? So you'll find that people will use perhaps a belt or something that goes along the ball of the foot to, again, bring the toes up towards themselves and get a good stretch in the back of the leg. Now, to isolate the soleus, which again is that deeper muscle, you would actually put something underneath your knee, right? So the knee now is in a slight bent position. I'm offloading, right, gastrocs, and now I'm bringing my toe up towards myself. So in that case, right, you're actually going to be able to isolate the deeper soleus muscle, and then you can actually see, you can identify, hey, which muscle out of the two might be shortened based on how much mobility you can generate in through the ankle area. So in some cases, right, somebody might find that when they're doing this exercise, like if this is my ankle, that when it's straight, hey, I can bring that ankle pretty close to me, but when the knee's bent, all of a sudden I lose that. So what that's saying then is that in that case, the soleus muscle would be the one that's more restricted and tight. If you have any questions or concerns for me, please feel free to leave a comment below. And thanks again for watching. And please make sure to check with a physiotherapist to make sure that this exercise is appropriate for you. Have a great day and take care. Thanks so much.